Have you ever noticed that you think you're suffering from erectile dysfunction, but you still have morning erections? Erectile dysfunction is not always a disease that you need to be worried about. In many cases, it's more about managing the situation. Taking pills loaded with side effects might seem like an easy fix, but remember, that's just a temporary solution. What if you could fix it permanently? To do that, we need to understand how erections actually work. One of the most important molecules involved in this process is nitric oxide. Did you know that most erectile dysfunction medications work by targeting the nitric oxide pathway? So why is nitric oxide so important? And what does it do in the body? Nitric oxide helps relax the smooth muscles in your blood vessels. This relaxation improves blood flow, which is essential not only for healthy erections, but also for heart health and overall body function. Nitric oxide is also involved in testosterone production. Testosterone is the hormone that's critical for a strong and healthy erection, but that's not all. Nitric oxide helps regulate cortisol, the stress hormone, and even plays a role in improving sleep quality. Now let's talk about stress. Stress is one of the most common causes of erectile dysfunction. Your body operates two main systems: the sympathetic system, which controls the fight or flight response, and the parasympathetic system, which is responsible for relaxation. For a healthy erection, your parasympathetic system must be active, but when you're stressed, the sympathetic system takes over, which interferes with this process. Let's go back to morning erections. Morning erections happen because, during sleep, your stress hormone levels are naturally low. This allows your parasympathetic system to dominate. If you're experiencing normal morning erections but still facing erectile dysfunction during other times, stress could be the main culprit. Reducing stress can significantly improve this problem. And here's something fascinating. Nitric oxide is also involved in regulating your sleep cycles. Sleep apnea, a condition that disrupts breathing during sleep, can increase your risk of erectile dysfunction. This happens because sleep apnea reduces the production of nitric oxide. People with diabetes are also more prone to erectile dysfunction. That's because diabetes damages the endothelial cells lining your blood vessels. These cells are the main source of nitric oxide in your body. On the flip side, nitric oxide increases insulin sensitivity, which helps control diabetes. However, it's worth noting that some medications, like statins used to lower cholesterol, can contribute to erectile dysfunction. After the age of 40, nitric oxide levels in the body naturally decrease by about 50%. So, boosting nitric oxide becomes even more critical as you age. There are a few effective ways to naturally boost your nitric oxide levels. First, practice nasal breathing. Nitric oxide is produced in your paranasal sinuses and released into your nasal airways. When you breathe through your nose, this nitric oxide travels to your lungs and circulates throughout your body. Second, make exercise a regular part of your routine. Exercise has countless benefits, including reducing stress, improving blood flow, and increasing nitric oxide production. Activities like brisk walking, cycling, or even weight training can make a big difference. Let's talk about foods. Certain foods are excellent sources of natural nitrates, which your body converts into nitric oxide. Spinach. A 100-gram serving can contain anywhere from 24 to 387 milligrams of nitrates. Beets. Drinking beet juice has been shown to increase nitric oxide levels by 21% in just 45 minutes. Carrots. These contain 92 to 195 milligrams of nitrates per 100 grams. Garlic. Boosts nitric oxide synthesis in the body. Pomegranate. Protects nitric oxide molecules from breaking down. Watermelon. Contains citrulline, which your body converts into nitric oxide. Other great options include dark chocolate, nuts, seeds, and citrus fruits. Now, here's what you need to avoid. Sugar. It can damage the lining of your blood vessels, reducing nitric oxide production. Alcohol. Regular alcohol consumption lowers nitric oxide levels and disrupts hormone balance. Stress. Chronic stress directly interferes with nitric oxide production. Don't underestimate the power of sleep. Good sleep helps reduce stress and restores hormonal balance. Aim for at least 7 to 8 hours of quality sleep every night. One final tip. If you're taking medication and notice changes in your erections, talk to your doctor. Some drugs can cause temporary problems, and there may be alternatives. To wrap up, nitric oxide is a game changer when it comes to erectile dysfunction. By making simple lifestyle changes, like improving your diet, exercising, and managing stress, you can significantly boost nitric oxide levels and improve your overall health. For a deeper dive into this topic, check out our detailed video on erectile dysfunction. Don't forget to like, share, and subscribe to our channel. Thank you for watching.